Deciding to get strabismus surgery can be nerve-wracking. Trust me, I know. I just went through it all 2 months ago. So today I want to talk about the questions that you should be asking your surgeon before you have the surgery that will help you have the best possible experience. So without further ado, here are the 5 questions I would make sure to ask your surgeon before you have surgery. First, what type of surgery do you do? So this is kind of a trick question because you're trying to make sure they only do strabismus surgery. You want someone who is a specialist, who eats, breathes, and sleeps strabismus surgery because it's an art and you want an artist who knows exactly what they're doing. You don't want somebody who's dabbling in strabismus surgery. So make sure they only are focused on strabismus surgery. Second, the question that I think a lot of people don't think to ask is, which eye are you operating on? Some people think that, oh, well, this eye is always straight and this eye is always out. So of course they're just gonna operate on the one that's always out. But what they don't realize is both eyes actually have the same problem. If you straighten this one goes out, and vice versa. Or same thing if it's esotropia, they go like this. So make sure you know, is your surgeon operating on one eye or both eyes? And honestly, the results don't differ according to research by too much. It's mostly a matter of how they were trained and also how large the angle is. If it's just a tiny angle, they'll probably just operate on one eye. If it's a really large angle, they might need to operate on both eyes in order to get the result that you're looking for. So I'm not a surgeon. I can't tell you what the right answer is, but yours can. So make sure that you ask that question. The third question that's really important to know is your surgeon going to be using adjustable sutures? Adjustable sutures are where your surgeon does the whole surgery, makes your eyes look straight or however they're putting them for the best result, and then they leave some of the stitches not tied off so that they can go back a few hours later or even up to a week later and make some fine-tune adjustments. So my surgeon did this and I'm so glad he did. I'm gonna show a picture right now. So after surgery, my eye decided to go all the way in, which was not okay. He made them straight and within a few hours, my eye had turned way in. So I was so glad that he was using adjustable sutures because he was able to go back a week later and make my eyes straight, which I'm so glad. Some surgeons don't use this and they don't find that it's necessary. They say that over time, it's not gonna make a difference. So it's an important question to ask your surgeon. Are they using adjustable sutures or not? One reason that it's really important is if you are a parent and you have kids and you're trying to come up with people to help you with driving or help you with other things while you're recovering, it's good to know that after your sutures are adjusted, you kind of start the whole recovery process all over again. And so you're gonna need that help with driving and all those things again. So make sure you ask your surgeon if he or she is planning on using adjustable sutures for your surgery. The fourth question that I think everybody should ask their surgeon is, will there be a PRISM adaptation test? So what is that? You might wonder, especially if you're having double vision, this is really important. So PRISM adaptation test is when they put a sticker prism on your glasses that makes it so that both eyes are looking at the same thing, kind of. So if my eyes are sitting like this and this eye is looking at a tree, this eye is not looking at the tree. So there's no way for the brain to fuse those two images together. But with a prism on your glasses, it moves the image of the tree out, and so it gives the eyes a chance to try to fuse that tree into one. And so it's a good way to tell if after the surgery and your eyes are aligned, if your brain is going to be able to fuse those things together. Also, the prisms are used so that if you are holding your eyes straight, you use this, they put a prism on your glasses and your eye might start relaxing out, relaxing out, relaxing out. And so instead of having an angle of 20 degrees, it might actually be 40 degrees. Well, this is super important to know before the surgery because if they correct you for only 20 degrees, your eye's just gonna go back out again. It's not gonna actually fix the problem. And so they need to know what the full angle is. So they do that using the PRISM adaptation test. So ask your surgeon, do you use prisms before surgery to help you know better how to perform the actual surgery? And the last question that I think everyone should ask themselves and ask the surgeon is, what results are you trying to get? For some people, strabismus surgery is mostly cosmetic. They have an eye turn and it's just kind of miserable, right? Like, I've lived that. Here's a picture. Right? So it's not fun to talk to people when they don't know which eye to look at and they're looking over their shoulder trying to figure out where are you looking, and they're trying to move to where your eyes are. It's just not fun. So having your eyes cosmetically straight is fantastic. It's so nice. Some people, that's the only goal that they have. Others are noticing problems with their vision, and having your eyes aligned can actually improve your peripheral vision, even if you're still suppressing one of your eyes. Some people are experiencing terrible double vision, and they're trying to get the double vision to go away by aligning the eyes. Others are working towards stereopsis, and they want both eyes to work together so that they can have that binocular vision and have the depth perception. Everyone has a different goal in mind with strabismus surgery, and for each person and each situation, it's totally different. So you need to do your job and research what you are looking for. What is the final result you want? I'm all about stereopsis, so my goal is to have both of my eyes aligned and working together, which is definitely the hardest option and the most time consuming because it requires a lot of vision therapy, surgery, and a lot more vision therapy. So I made sure to communicate that to my surgeon before he even cut into my eyes so that he knew and that we could have our goals and be on the same page. So definitely talk to your surgeon about it. Make sure you're on the same page with that. So those are the 5 questions that I would make sure you talk to your surgeon about before having strabismus surgery. And if you want the other 22 questions that I asked my surgeon, plus all the answers that he gave me, all written out, it's all on my website at lazyeyesolutions.com/surgery questions. Good luck with your surgery, and I hope it goes amazingly well.